All right, so we're going to talk a little bit about hormones, aging with interest. I'm going to try to stay on topic because there's a lot of things to go through. All right, ladies, you all remember it when you walked into the room and you turned heads. You could multitask till the cows came home. You had that fit, in shape look, and you were glowing. And what about you guys? You could hit that golf ball, play 18 holes, watch that ball go and go, still do the honey-do list when you came home, and maybe energy to chase your wife around. But that's not always what ends up happening. We go through menopause and andropause for men, which is the decrease in testosterone production. And it changes a lot how we feel. And we're going to see tonight why hormones have such a diverse effect in how we feel, because it's more than just our sex hormones and fertility, obviously. And hormones may not be for everybody. And so a good part of this talk, I talked a lot about managing our estrogens, not only the estrogens we make in our body even after menopause and estrogens that men make, but also estrogens that we get exposed to in our environment that we don't necessarily want to be getting exposed to. So this is some of I tried to stick with it here. There's a zillion things that we could have talked about, but for time constraint, I try to stick to the nuts and bolts and get the basics down. Okay, so the purpose of this slide is just to show you that really all hormones come from cholesterol. And you can see as you go down, you get your progesterone, you go down, and ultimately you can get your DHEA, all from cortisol, from cholesterol, and you get down, you get your testosterone, and you can see here that testosterone does become an estrogen. That's an estrogen, which I'll explain those in a bit. The point is to just know that testosterone can convert into estrogen, and as men age, that tends to happen more and more, and that's not necessarily a good thing. So estrogen affects organs. You have receptors or keyholes for estrogens all over your body. It's not just your pelvic organs. In your liver, your heart, your brain, your bone. These are all target for both men and women, okay? And estrogen effects are very diverse. And in men, estrogen still helps regulate temperature. It helps regulate memory. It helps play a role in your bone health. It plays a role in your cholesterol production and therefore your atherosclerosis. So estrogen is not just in regards to women, it's also in regards to men, because all these things are affected. And later, I'm going to talk a little bit about how estrogen also affects the prostate. Okay? So where is estrogen produced? In women, it's produced in the ovaries until they go through menopause, and then it's primarily produced in the adrenal glands and what we call the peripheral tissues or other tissues. And by peripheral tissues, we primarily mean the fat tissue or the adipose tissue. Okay, there's actually aromatase is the name of the enzyme that converts testosterone into estrogen. And so a lot of things that we try to do in medicine for men is to block that from working so much. And there are some things I think I'll just mention them here, but when you're overweight, if you drink alcohol regularly, if you have low zinc in your body, if you are diabetic or insulin resistant, this is going to convert more this way. And so that's some of the things. When I do supplements, I didn't do supplements at all for this talk because I had too many slides, but I will mention some of the things that will naturally block testosterone from converting to estrogen, and one of them is something as simple as zinc.
What
Percentage of how much do you take? Anywhere from 25 to say 75 milligrams in a guy. It needs to be balanced with copper, which I'm going to be talking about in the weeks to come. Actually, I guess it's next week because it's our last week. Okay, so testosterone. This is what men look at testosterone for, right? Yes, it's part of their fertility issues, but it also helps you make red blood cells. It also helps maintain bone. It plays a role in our muscle mass and as well as our sex drive and that general sense of well-being. I feel good, I feel at ease. And don't underestimate, it can do the same thing for women. And women do get low testosterone. One of the biggest reasons women get low testosterone is from birth control pills. A lot of women have been on birth control pills for many years, and it lowers testosterone significantly, and they come in with no libido, and they've been on the pill forever and ever and ever. So now that we know all the good things, what happens when we lose it? And here are itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. And these are the 7 dwarfs of menopause, and don't worry, men, you're going to get your turn too. So why so many symptoms, right? I mean, all the way from bloated up to like bitchy, you know, like where is this whole thing? And that was back to that slide showing that you have keyholes all over your body for estrogen and progesterone. And so when you lose it, you get diffuse symptoms. It's not just, I'm not getting a period anymore. It's a lot more than that. Okay, so I don't think most women know these signs, but again, your muscles are thinning. One of the things that we talked about, you lose about 0.6 kilograms of muscle mass per year, a couple percent every decade. And you lose bone loss, and you get cracked heels, and you gain weight, and you sleep bad, and all these other things happen. I mean, any woman in this room who's been through menopause can stand up in here and tell you, yep, that's me. And what about men? Men start dropping their testosterone in their 50s, and that's pretty significant. Okay, that's a big drop. Women are actually losing their progesterone as early as their mid-30s. A Harvard study shows that women are losing their progesterone as early as the mid-30s, and that's part of why fertility is an issue for women past their mid to late 30s, because progesterone is what maintains the pregnancy until that placenta forms, and women aren't secreting enough of it, and that's a big issue. So men end up having a lot of problems too when they go through menopause. And this is Michelangelo with testosterone deficiency. So here's your slide. So, it may be brain loss, it may be mood changes, it may be, not sharp, it may be grumpy, it may not be able to concentrate or sleep as well, increased heart risk, heart attack, stroke. This is what happens as our hormones change. And in anti-aging medicine, aside from the theory of we've talked about oxidative stress, also having your hormones decrease is a lot of what ages us, not the other way around. Okay, so before we go on to talk about replacement, we got to do a little busy work, because a lot of people hear the word estrogen and they think it's just one thing, and it's really not. Okay, and it's an important distinction. There's actually 3 main estrogens, and we literally do call them E1, E2, and E3, which is great because the words get kind of confusing when you say all of them. And these estrogens all are made in the body. Men don't make any of this. This only really comes until you're breaking the estrogen down, which I'll show you. But these all have different effects in the body because, as I've told you before, hormones are the key and the receptor's the keyhole. Okay, so you've got all these estrogens, and you can see they're not all exactly the same shape. They're similar, but they're not exactly all. So the key's got a little different crevices in it. Okay, so it's going to fit on different receptors, okay? And that's a basis of what I want to talk a little bit about now, because it's important to understand the differences. And this is one of the things that I see that is done wrong with hormone replacement therapy. These things are not looked at in women. So I'm going to make sense of this. This is the type of estrogen, E1, E2, and E3. They have receptors or keyholes. I like to keep it simple. They're good or they're bad. Bad meaning that they stimulate breast, ovary, uterine, and prostate, okay? Because prostate is involved more than the good receptors, okay? So here's one estrogen. It hits 1 to 5. It's more bad than good because you're hitting more of the bad receptors. This is your main estrogen in the body. It's the main estrogen that makes you feel like a woman. Curvy hips, libido, breast development, I can find my next word, bone health, heart health, and it kind of hits the receptors equally. This serves more as a reservoir for this estrogen when the body needs it, because they can convert, and it also plays a little bit of a role in bone health. This estrogen is a kind of a weak estrogen, but ultimately its safety profile is 3 to 1. It's more good than bad. And it doesn't have as much of the cardiovascular benefits as the other estrogens do in the bone, but it can help menopausal symptoms. And what it does do is it blocks these guys from sitting too much in the keyholes. In other words, this can sit in the keyhole where these two would like to be and not activate it, not turn the key. It's like, I got the right key, but it's just not going to turn. So it'll kind of sit there and block them from overstimulating in a way, is the best way for me to explain it. The important part for women is that before menopause, you don't make a lot of this estrogen. You really don't. It's maybe 10%, 20%. But once you go through menopause, this becomes your predominant estrogen. And we just said that we don't really want to have too much of this, and it becomes your predominant estrogen. So this is my case for, well, I don't want to take hormones because I don't want to get breast cancer. Well, guess what? As you age, you are at risk for that without taking any hormones. This is not taking any hormones. This is what your body does all by itself. And what you're lacking at this point in your life when you're perimenopausal and menopausal is progesterone to balance that effect, which we're going to talk about. So the take-home point is you have more than one type of estrogen that are hitting more than one type of keyhole. There are good keyholes, there are bad keyholes, for simplicity's sake, and they each affect those keyholes a little bit differently. And the type of estrogens that you produce change when you go through menopause because the ovaries kind of shut down and you're just left with your adipose tissue from the testosterone that you make estrogen or your adrenal glands. Did I lose anybody yet? We good? All right. All right. So those estrogens, though, the reason I put this slide up here is I want to talk a little bit about xenoestrogens because xenoestrogen stands for outside the body estrogens. They are hormones. They're hormone disrupting chemicals and they mimic estrogen. Okay? What does that mean? It means that metals, a lot of our skincare products, the things we clean our house with, many pharmaceutical drugs, synthetic hormones, industrial chemicals, they all act like estrogen, and in particularly, they act like this bad estrogen that we don't want to have a lot of. So we get exposed a lot, but there's a lot of ways that we can control it. We don't need nonstick cookware. You can use aluminum. I don't care what they say, it doesn't have Teflon in it, blah, blah, blah. If it says nonstick, it's garbage. Get an aluminum pan, stainless steel pan rather. They work great. You can go to, early on I'd given you that website ewg.org. It's a great resource because they rate everything from skincare products to suntan lotion to all sorts of things.
You said no aluminum?
No aluminum. I meant to say stainless steel. I'm sorry. Thank you for correcting. Stainless steel is good.
But you don't want to use aluminum?
No.
At all?
No. You don't want to use aluminum pans. Okay. It's a metal. So you can use cast iron. I don't have the patience to clean cast iron things. I actually, one day, this funny story is when I first got into all this, I bought all new pans. I got all the cast iron stuff. I looked at all of my kitchen. I said, who am I kidding? I am not going to clean this stuff right. I sent it all back and got myself stainless steel, and I've been a happy clam ever since. But it requires a lot more care, the cast iron, and I just knew I wasn't going to do that. So anyway, so the point is plastic bottles, a lot of the things that we're cleaning with, Clorox, all that stuff is disrupting our own hormones. So what does it mean to mimic estrogen? It means that here's your estrogen, here's your xenoestrogen. They look similar enough that it will still fit in the keyhole. And the problem is that this is actually sending a message to it's binding it, it's sending unintended signals. It's sending effects that we don't want to happen. We don't want children to be menstruating at 8.5 years old. And this is some of my theory as to why. It's not just the hormones in the food, it's other things that kids are exposed to and toxicities. So we don't want that. And men, this can affect you as well. Estrogens play a role in prostate cancer. Yes?
BPA effect too?
Yeah, BPA is an example of that, from the plastic bottles. And you know, the BPA-free things that are like mimicking it, it's going to come out to be its own little worst thing. I drink out of a stainless steel, usually, this is it right here, my bottle, with a silicone cap usually. Do I go to the airport and get plastic bottles? Yes, I do. And I have good affirmations when I do it, and I don't feel any negative energy, and I decide this is the water I can drink right now, and it's going to be fine for me. But so I'm not trying to give you scare tactics because you'll make yourself nuts. But you can choose reasonable guidelines. I mean, you know, I use sunscreen for the kids. I choose to get the better stuff that is thicker and it takes a little longer to rub it on, so I put the sunscreen on before we leave the house. Big deal. I change the pans. I use filtered water. I mean, there's little things that you can do. You know, I don't microwave my food at all, and I certainly would never microwave it in plastic. I mean, that is just like, I saw my employee doing that today. I almost fell over. I'm like, what are you doing in my office with doing that? I'm like, okay, I'll allow the microwave, but please don't put it in a plastic container. So, you know, I just had a little, Okay, so this is kind of, I want to show this because we've talked about the recurring theme of our genes and the environment, our genes and the environment. So when that estrogen molecule or that keyhole sits in that receptor, It sits on there and it goes right into your DNA, and it has a response, and it changes things the way they go. When it works the right way and we're either balanced in our hormones or our bodies are functioning normally or we're limiting the toxin, we're not activating things that we don't want to activate. That's my point. So the toxins and the things that we're getting exposed to are activating our DNA and turning our genes on and off, and not always the way we want them in the positive light. We're good so far? All right. So what is this estrogen dominance? Because men can actually get it too. And it's when you have a couple of different situations can occur. It can occur when a woman is perimenopausal and she has X amount of estrogen, X amount of progesterone, and now she just lost her progesterone, but the estrogen stayed the same. So you didn't really raise the estrogen, but relative to the balance of your progesterone, you are now estrogen dominant, because the body always wants to be like a little level seesaw on each side. It wants to be even. And once somebody sits down on that progesterone and dumps it out, you end up with all this estrogen, even though your levels didn't change. You can get it from exogenous things like the environment. Men can get it from testosterone, if testosterone's being replaced in particularly, and it's all converting over from that aromatase, it's becoming estrogen, or even if they're not on replacement, it's just all being shuffled over. And the problem is it can have a lot of adverse effects of the things that we're trying to avoid. So in men, for example, it may affect prostate growth. In women, it might cause fibroids. It can set you in an environment that's riper for cancer than we'd like it to be. And so it's an issue. We don't want estrogen dominance. Okay, so a lot of you would say, I put some of the reasons up here. So a high sugar, high glycemic diet, low fiber, excess alcohol will cause estrogen dominance. Chemical disruptors, what I just showed you that slide. Medications. If you're not balancing your hormones in food, that's why I try to eat organic. Lots of cortisol from stress can be an issue. If your liver's not working right, if you're not removing the estrogens from your body, lots of body fat and not enough zinc. Those are some reasons why you can end up with more estrogen than you would prefer to have. And so one of the biggest issues is that estrogen causes weight gain. And I just had a classic example. I had somebody today who, in the defense of the practitioner with what was in their toolkit, they made the best choices available. However, this woman, I didn't even test her yet. I know she's getting too much estrogen. I mean, she's like, I gained like 30 pounds, I'm a mess, I'm this. And I'm like, oh, you have so much estrogen, you don't even know what to do with it. And so what happens, you start increasing your estrogen, you may actually lose muscle mass and increase your fat, because this is not balanced. This is not just taking estrogen. If you're not balanced, you get more obesity, and then those adipose cells can actually convert that testosterone into more estrogen, and you just keep playing the vicious cycle of the weight gain and the hormone imbalance. So everybody would say, well, why on earth would anybody take estrogen if it does all these things that are bad for you? Well, part of it, again, comes back to the balance, because estrogen and progesterone want to be in balance. And you can think of estrogen as the gas on the gas of the car, and the progesterone's like the brakes saying, whoa, slow it down, okay? So for instance, you're going to stimulate breast growth, maybe cysts, the progesterone will calm it down. Excess estrogen might give you headaches, but progesterone is actually kind of a natural antidepressant. It actually sits on the same keyholes, the same receptor, as things like your Valium and your Prozac, okay? So it can improve mood. Estrogen may cause clotting if you're using it by mouth, and progesterone prevents it. Excess estrogen can increase your sugar, progesterone can help normalize it. Now, you have to know that excess progesterone can do the same thing. And one thing that I didn't show, and I'm just going to show this really, is the whole balance, because all that hot flashes is not low estrogen, and that makes me crazy. I need more estrogen. I'm like, no, you don't. Either your thyroid's off, you're too stressed, or your blood pressure. There's a lot of other reasons you can get a hot flash other than just low progesterone, low estrogen. So I show women that, or even men too, here you feel bad. Here you feel great. Here you're on a low dose of hormones, and here you're on a high dose of hormones, okay?
What's your hormone?
Any hormone, whether you're talking about testosterone or estrogen, almost doesn't matter. So as you're increasing the dose, we're going up, you're feeling better, right? You keep feeling better, you keep feeling better, you keep feeling better, and then you keep pushing me to increase it, and then you fall off the cliff. And then you feel at this dose just like you did when you were at a lower dose, because you've oversaturated the keyholes or the receptors in the car. It's kind of that, almost that same theory of when you become insulin resistant. Remember I told you when you get type 2 diabetes, or even before you get that, there's plenty of insulin floating around, just the receptors are not working. The same thing happens with hormones. So initially, women get put on these high doses, they feel great. I mean, hormones are steroids, right? So you feel good. And then like after a couple months, when the high's gone, you feel bad because you feel worse than you did before you started the hormones, because in my opinion, you got overdosed. And that's a big issue. So what else? There have been studies that progesterone shows to lower breast cancer risk. It blocks you from getting uterine cancer if you have a uterus. But I want you to look at all of these effects, because one of my golden rules of hormone replacement therapy is you always take progesterone when you take estrogen, whether you have a uterus or not, because you have the whole rest of your body, like 2 breasts, namely. You have bones, you have a brain, you have other issues of why you would not want to end up estrogen dominant. I mean, these are all these effects. We don't want these effects, and that's what ends up happening. It might stop the flashes, but it doesn't always help everything else. Okay. So why would people take hormones? I just want to say a little bit about this too, because people like to say, well, they're natural. Natural versus synthetic is not the best way to classify hormones. They're either bioidentical or they're not. For instance, Premarin is a natural hormone, but it doesn't look anything like your body's estrogen. And that's all that bioidentical looks like self. So when that hormone structure that I showed you, the body can't tell any difference of that. Okay, it looks the same. It comes from yams. In the past, it also came from soy. Pretty much all bioidenticals come from yams now. And the key and the keyhole fit. They work, they talk to each other, and everything is good. So it looks like the body's hormones. So what happened though was in early, I guess over 10 years ago, this study came out and it became gospel for hormone therapy. And as far as I'm concerned, the baby got thrown out with the bathwater. Okay, what was the problems? And I don't want to get to the whole statistics because that's not the point. The take-home point is estrogen was not bioidentical, it was Premarin. And it mostly mirrored E1, the estrogen that we don't want, that stimulates breast tissue. And then women who needed progesterone didn't get progesterone, although the lay literature and the media and even doctors still like to say progesterone and progestin interchangeably. They are not interchangeably. It is one of my biggest pet peeves. They are not the same thing. If you go to Spiroff textbook of GYN endocrinology, it's clearly defined the difference between progesterone and progestin. There's a big difference. Progestin actually, remember I was talking to you about how progesterone, that previous slide, actually has a calming, kind of like a brake effect. Okay, the breasts are getting too big, let's put a little brake on it. Progestins actually enhance the negative effect on the breast. So it's like magnifying what that 1 to 5, I was telling you before that it mostly mimics that bad estrogen, right? 1 to 5, more bad than good. And then you threw progestin in it that hit more of those bad receptors. So it's not really a surprise that there was a higher risk of breast cancer. But they also forgot about the 30-some-odd% of improvement in bone loss as well as colon cancer prevention. And there's other studies that were done in Europe that show benefits of bioidentical hormones. Okay, so this is important because it becomes all hormones got thrown out with the bathwater with this. All hormones are bad. That's what ended up happening with that study. So what are some of the benefits? Well, they have shown that women who have higher levels of estriol, which is that protective estrogen, actually had lower breast cancer risk, and vice versa has been shown. Natural progesterone, unlike that progestin, which was they were used, actually lowers your risk of heart attacks, blood clots, and strokes. And progestin increases all of that, hands down, okay? Just quick aside, and I don't even know if I put it on my do not do slide, but in case I didn't, never, ever, ever use birth control and hormone replacement therapy. It's a big no-no. Birth control, do not use birth control pills as hormone replacement therapy. That's for my women, okay? Your doctor's gonna tell you, but it's low dose. It's a bunch of hogwash. Don't do it, okay? Why? Because of this exact factor of the progestin increasing heart attacks, blood clots, and strokes. One of my colleagues just lost one of her colleagues a few years ago. The lady was in her late 30s, probably 39. had a procedure for skin cancer removal, had swelling afterwards, ultimately had a blood clot that traveled to her lung, and she died. And she's telling me this over wine, and mind you, this is a few cocktails into it, and I said, let me guess, they don't know what was wrong. No, they don't know why she had the stroke. I said, and how long has she been on birth control pills? She was on birth control pills. I'm like, I rest my case. It's not intended. Do I give women birth control pills? Yes, when they need it for birth control, because a side effect of pregnancy when you don't want it is a bad side effect. So you have to balance all of that. And I get very angered, as you can see, a little enraged when the doctors blow it off as women. It's no big deal. It's a big deal. It's a big deal. Don't take it as birth control. I mean, take it only when you need it for birth control. So they have done other studies. Some of the forerunners is a lady named Agnes Fournier. She did a whole epic trial all over in Europe. And they actually showed some of the benefits that estradiol and natural progesterone actually had a 10% decreased risk in breast cancer. And there's other published studies that show up to 25%. There's a very good review article by an oncologist, and I think I put his book as a reference. It's called Keeping Abreast, and his name is Khalid Mahmood. I think he's in the handouts. Anyways, he just published a good article a couple years ago that also reviewed a lot of the data, and he's like, isn't there a safe way for us to do these bioidenticals without women not being able to have them because of the benefits? I mean, progesterone's actually shown, for instance, natural progesterone, again, when I say progesterone, I mean the kind your body makes that God gave us, actually turns off genes that cause cancer and has been shown to turn on genes that prevent cancer. Okay, so there's a lot of benefits. It's not all bad. And I know a lot of people say, well, if God wanted you to have hormones, you know, he would have given them to you till you died. Well, whatever. We used to only live till we were 55 and we died. We're living 30 plus years longer. Just like you used to be able to take more money out of your retirement fund, you can't do it as much because you're living longer, okay? And so I personally think God was just waiting for us to find these hormones that he already made. When are these people going to figure it out? Okay, so here's my do's and don'ts. Do not take any estrogen by mouth, even if it's bioidentical. So a lot of women come to me and says, yeah, I'm on hormones and I'm doing bioidenticals, and they're taking a capsule. No. Whether the estrogen is bioidentical or not doesn't matter. Once you put estrogen in your mouth, it goes through the liver and it creates an enormous amount of inflammation. It's the same reason men don't take testosterone by mouth. Testosterone is either given topically, injections, or you can do troches and sublingual, but you still end up absorbing some of that. So I don't usually do that. So when you take the estrogen, it can cause heart attacks, strokes, blood clots. It stresses your liver, increases your insulin resistance, and a whole host of other problems that we don't need to have because there's other ways to take it. Okay? Natural progesterone, however, can be taken orally or topically, and I go back and forth with that. The studies are not definitive. I tend to use oral if a woman does not sleep well, and some women do great on topical. For me, that's part of where I use my intuition. I mean, I listen to what people are cerebrally telling me, and I'll decide, okay, I think that this one's going to do better with the oral. Other times, I just have this feeling, I think this is going to work out better for her. We're going to do it like this, and I present the plan to them, and it works or it doesn't work. You know, we make a decision together. That's my little do not take. If always take natural progesterone, even if you've had a hysterectomy. And don't take over-the-counter progesterone or DHEA or pregnenolone without being monitored by a knowledgeable physician. It makes me crazy that this stuff is available over-the-counter. I can go back, you can look in your slides. DHEA converts into estrogen and testosterone. So this is a famous thing. Women are already estrogen dominant because remember I said in your mid-30s your progesterone goes down in the toilet. You still have all this estrogen. They decide they need to take more DHEA, which does what? Just raises their estrogen more. So I don't recommend that.
Excuse me.
Yes?
What's the downside of the pregnenolone?
Pregnenolone, if you go back all the way to the beginning slide, it can convert further down to those other hormones. I think a low dose of pregnenolone is probably fine. I mean, there are some studies and people say it benefits memory. But the progesterone, the creams end up having a lot in them, and people end up getting overdosed on their topical progesterone creams that they're getting in the stores because they don't really know how much they're taking. And so let's talk a little bit about hormone and dosing. And so this was a typical example. This woman who I saw today, she's been getting her estrogen by a patch, which is fine. It was bioidentical, but she's being followed by blood levels. This has been shown over and over again. When you use something topically, a hormone, it is not going to show up in your serum until you push that dose high enough, until you're basically overdosed on it, then it shows up in the blood work. So it's very, very imperfect to look at blood levels when you're using your hormones topically. You want to know what's going on at the tissue level of the hormone, and that's why you use your hormones topically, particularly the estrogen and the testosterone. And so some other ways you can, if you're using the right lab, saliva test, it can be very helpful. And one of the companies actually devised a finger stick that is almost the equivalent of doing saliva testing. They can't measure that one estrogen that I don't particularly like that much, but it's a good option. I have women who just, for whatever reason, can't do the saliva. It doesn't matter. They don't like spitting, they don't have enough saliva, yada, yada. We do a finger stick. It gives me a better idea. Anything's better than doing the blood test. And also urine is really important. It gives me an option not only of levels, but a little bit about, we're going to talk about breaking down that urine. And if you go back to your earlier notes, we're going to get to that slide, we talked about detoxification, and estrogen detoxification is very important. I mean, God has its own pathway to break down estrogen through the liver. It's very important. So those are my little take-home points. And I'm glad I said about that birth control pills, because I did not add that on that slide, so I will add that for the future. Okay, so what about testosterone? Why is it good? It improves muscle mass, which lowers diabetes risk. It improves your bone health, which lowers osteoporosis, lowers the risk of heart disease. And yes, we'll talk about a little bit about the controversial studies that came out. Improves cholesterol, decreases overall mortality by 40%. And low testosterone may even increase risk for prostate cancer. And at the least, it increases the aggressiveness, and there's a higher mortality when your testosterone is very, very low. Improves mood, improves libido, and sometimes when your testosterone is low, it's a reason that the little blue pill doesn't work, because the Viagra actually needs a little bit of testosterone to work. And so sometimes erectile dysfunction pills don't work because men actually have low testosterone. Conversely, and I did not say this in a slide, many times men present with erectile dysfunction, and it often precedes the diagnosis of heart disease. So when I have a guy come to me with erectile dysfunction, I do screen them pretty well, and I really do encourage, I always do at least an EKG, and I usually encourage a stress test, because the same arteries that are allowing an erection to happen are the same arteries that get clogged up in your heart. So if you can get it here, you can get it in your eye, you can get it in your kidney, you can get it in your penis. I mean, it can happen. So I look at that because it's important. And a lot of men say, well, you know, I don't have low testosterone because I have a good libido. My libido's great. Well, really, though, by the time your libido's dropped, your testosterone's been low for a long time. Usually the other things happen. The mood changes, the motivation, that kind of stuff. So there was a couple of trials recently, at least 2 trials that came out that said, oh, testosterone therapy causes heart disease, don't use it. Well, these were horrible studies. Just do a little time check. Good, I'm good. I got a few more minutes. And some of the problems were 60% of the men were not having their testosterone levels monitored. In those that were, many were not adequately replaced. Most of them were not having their estrogen levels monitored. And high estrogen, we told estrogen dominance could affect the heart. Hemoglobin was not monitored. And I was telling you that testosterone stimulates red blood cell production. The other thing that stimulates red blood cell production in men is smoking and sleep apnea. And so a lot of times guys are overweight and their testosterone's low. They don't want to go for that sleep study. I'm like, okay, we'll do it your way. I do their CBC in like 8 weeks and their hemoglobin's through the ceiling. I'm like, you need to do that sleep study. You're going to come off the testosterone. It's one or the other, because that's affecting you. And so now your blood becomes thicker when you get a high hemoglobin. The thicker the blood is, the more likely it is to clot.
What's a high hemoglobin?
Say somewhere over 17.5, I would be concerned. And I kind of look at those things critically. And I had a physician I took care of many years ago who liked to monitor his stuff himself, and he was very high, and he had a stroke. He probably had a congenital abnormality, but I was like, you know better. You're the trauma surgeon. I'm just the hormone doctor. So anyways, you got to, I'm not trying to, make you afraid of it. It's just that there's just things that need to be monitored. Blood counts need to be monitored. Okay, and one of the big things that I want to get off the table is, for years, doctors would say, well, your testosterone's normal for your age, right? Well, Abraham Morgenthaler, and if I did not put his book down there, he's got a book called Testosterone for Life. He's a Harvard-trained urologist. He is like one of the pioneers in testosterone replacement therapy. I've actually had the honor of hearing him lecture, and he's been was part of my master's program. He did a lot of the original trials showing that testosterone is safe in men. It does not cause prostate cancer. There are no trials that show that it causes prostate cancer, although I'm sure they're going to rig another trial that is a crappy trial and say, oh, it causes prostate cancer. See, I told you it's bad. Anyways, he did some of the beginning studies on that and showed that testosterone replacement therapy is safe, and it's even safe in men who've had prostate cancer as long as the prostate cancer has been in remission. The only time that testosterone becomes a problem is if men have a prostate cancer that is extended outside the capsule of the prostate gland, meaning it's gone deep enough through that it's starting to protrude out. If you give those men testosterone, they will have more problems. That's why when men have very late stage prostate cancer, they are put on significant testosterone blockers because of that data, that once it's already spread, when you've got a guy who's got, metastatic prostate cancer, they do a lot of hormone manipulation and they drop everything down. So what happened is these guys their hemoglobin was not being monitored. They were getting replacement, right? This is testosterone causes heart disease. They were getting the replacement. Their hemoglobin was rising. Nobody was checking what was going on at home, and the blood got too thick and they clotted. And so that's an increased risk for heart attacks and strokes.
Seems like I've heard some ads from lawyers on TV.
Right. Of course. And it's unfortunate because this whole bioidentical hormone thing, they've not perfected this yet at all. I mean, nobody can stand up here and say, oh, it's been perfected. The New England Journal of Medicine published a trial years back that said you start men off on 50 milligrams of topical testosterone. If they don't feel good in 2 weeks, you double it and then you triple it. That is an insane amount of testosterone. And just relatively speaking, your testicles make 6 milligrams of testosterone a day. Why would you slab on 150 milligrams of testosterone to your skin? Because it's this idiotic thought process, oh, it goes to the skin, you don't absorb anything. You absorb tons. They've used saliva testing in our astronauts, okay? It's the real deal. It just hasn't made it to mainstream and the whole bit. But it really does show benefits. So this was some of the do's and don'ts. Don't take testosterone by mouth. Avoid commercially prepared. I don't like a lot of the commercially prepared testosterone gels because the doses are too high. The new one, I think there's the androgel pump. That's a little bit of a lower dose, but it's very hard for me to control how many milligrams I'm giving somebody. X amount of pump is this dose. I can do the pump every other day. I can do 1 pump or 2 pumps, but I can't pick the exact dose of what I want to do when I send it to a pharmaceutical, to a compounding pharmacy. I do use injection testosterone for men because men like it. I try the creams. Many of them are needle phobic, so we try creams. Probably 50-50. Some of the guys feel great. Some of the guys are like, you know what? I'd rather do the injections. We teach them how to do it. They do it themselves. The longest, though, you can ever go is 2 weeks. It really should be weekly or biweekly, and so it's hard for a lot of guys. If you are doing injection, you can look at the serum level. You can look at that. It's a way to look at it. I still prefer to look at the saliva or urine breakdown as well. You need to do proper prostate cancer screening, and yes, even though it doesn't cause it, what if you have something brewing that nobody fell and the PSA was fine? So you do monitor the PSA. You don't hang your hat on it until you're hacked to death and being prostate biopsied at the wazoo. But if your PSA rises when you're on testosterone therapy, I usually tell men, a couple things. Ejaculation 48 hours prior to getting a PSA level, strenuous exercise, tight biker shorts, or sitting on a bicycle seat those 2 days prior to getting it level will falsely elevate the PSA. So I usually tell men to avoid that so we get that out of the way. But also, if the rise is significant, if you go up by more than 0.75 from PSA to PSA, there's something going on. Sometimes they do additional tests to decide if further work needs to be done. But there comes a point after you've biopsied the prostate and you go back on the testosterone, you keep getting back to the same level, you have to decide, this is the new set now for this guy. And Morgenthau actually said it when I lectured with him. Some men's testosterone is so low that their PSA is 0.1, like it's not even there. You give them testosterone, their PSA comes up. They're allowed to get a new baseline of normal. It doesn't mean you ignore it. You investigate it, you work it up, and you follow out where the new baseline is. And you have to follow estrogen and estrogen levels. And you do want to know if sleep apnea is there. I wanted to talk a little bit about this quickly. And this was, I was talking about, estrogen goes through its own breakdown products. Remember, steroids are fat soluble, so they're not dissolved in water. And the whole process if you even look at that slide, the detoxification is taking our waste products, whether it's good waste that our body makes or waste that we're getting exposed to or medications, that is not dissolvable in water, so will not come out of us until we make it water soluble. That's why the body goes through all these reactions. Well, when you take estrogens and you put it into the first step one, remember I told you if you don't get from the washer to the dryer, you end up with these kind of nasty, moldy, wet clothes? Estrogen, let's go back from like the first or second, I think maybe the second talk. Estrogen really can cause a lot of problems, and that's where we measure things. We measure those breakdown products because we know what shows us increased risk for prostate and breast cancer and how to kind of avoid that, and you manipulate it. I mean, here's some of the supplements down here. Milk thistle, turmeric, these are things that will affect detoxification. Cruciferous vegetables are key. All your broccoli, your kale, those are great foods to eat. Okay, you want, good.
Do you think DIM works?
DIM works, Yep, and I mentioned that on a slide for next week. So this also just shows other things to promote healthy estrogen levels, and actually DIM is up there. DIM is just the active form of I3C. Some people cannot convert it. We don't really know for sure which one works better. I usually just use DIM, but some people use a mixed product. I think they're both probably okay. We don't really know for sure. And this is just showing ways to maintain healthy estrogen metabolism. As always, balance is the key to life. That's how I stress hormones. Hormones are a symphony, and if you get one thing off, they all get off. For women, it's often the insulin. Their insulin is high and their cortisol is high, and that affects how their hormones actually feel. You know, how they feel when they take their hormones. That's what I'm looking for. All right. Did I lose anyone?